All right, welcome back. We're going straight to Abeokuta in Ogun State, where we have standing by Dr. Funmi Bamiselu. She is the program manager, Ogun State Malaria Elimination Program. Many thanks for staying with us on Galaxy today. When we started, I reeled out some statistics, and it is actually very shocking to note. I'm sorry, I said the lady is actually a man. I reeled out some statistics. We have about 300,000 deaths recorded in Nigeria alone when it comes to malaria. What is the situation in Ogun State?
States, just like what we have in the country, the percentage of children that also come down with malaria is we have almost 70% of our outpatients that we record and that we have the data that we have that they present with malaria illness. Then even inpatient, to those that are on admission, about 30% of them are mostly treated on malaria. So that is the situation we have in the states.
About this, most times a lot of doctors blame it to poor hygiene, because we know that one of the causes is having stagnant water around our environment. Is it a thing that the average Nigerian is not really so conscious about personal hygiene, or what exactly are the issues? If we still have rising cases of malaria in Nigeria, there must be some things that we are not doing right.
Yes, I think the main thing is the preventive aspect of this malaria. How do we prevent it? That is, we are not really doing much about that prevention. That is why we are having increased cases. And talking about prevention, we have some intervention that we're supposed to observe, like the environments where we live. We should ensure that we don't have any drainages, stagnant water that will be serve as a breeding site for malaria, for the mosquito that transmit the malaria parasite. So that is one of the main problems we have in the country. Then also this our intervention, making use of insecticide treated nets, that we know not many people are really making use of this insecticide treated net. That's why the fact that we do mass campaign to distribute this net, and we also have a routine distribution to pregnant women and children under 5 that have completed immunization. It seems we still need to enlighten our people on the benefits to sleep under the nets, and on how to use it properly, so that they can prevent insect bite, because that is the only way we can prevent malaria, the bite of a mosquito. If you can prevent that insect bite, it will reduce the incidence of malaria in the states.
About some of the programs or the campaigns that you have done as regards this fight against malaria. You talked about distribution of insecticide-treated mosquito net. What more have you been able to do specifically in the hinterlands?
Yes, talking about what we have been doing, we have been implementing the strategy to control and eliminate malaria in the states. And some of those strategies include appropriate management. I'm talking about appropriate management, making sure that we do prompt diagnosis of any suspected malaria cases. We will test any suspected malaria cases, because it's not every fever cases that are caused by malaria. And after the tests come out to be positive, we ensure that patient gets drugs. And this testing and drug, the ACT drug, anti-malaria drug that we give, they are free for patient that comes to the public facilities. Then also, we also make sure that because there are some high risk group in the population, like the pregnant women too. So for those pregnant women, we ensure that they are given IPT. After the first trimester, by 4 months when they visit the facility for antenatal care, we commence the IPT with them, and they collect it every month. So those pregnant women that have been attending public facilities, I can confidently say that they have been receiving this IPT, this drug that we use for IPT, intermittent preventive therapy. And this drug is to ensure that during pregnancy, they don't come down with malaria. And also, it also protects the fetus, the unborn child in the womb, and make sure that the child come out without any problem, any miscarriage, or sometimes if you don't treat malaria in pregnant women, it can also result to low birth weight. So those are the things that the intervention that we have been doing. Then I've also mentioned for under 5, we ensure that after they complete, children that complete immunization at the end of 1 year, that they collect LLIN, the insecticide treated net. So this is to ensure that those children they are able to sleep under the net and prevent, because they are also a susceptible group to malaria, to develop severe malaria. So those are the interventions that the state is being installed.
Sites that you have shared so far. Let's talk more. Let's stay on the children under the age of 5 now concerning malaria. If malaria is actually preventable and actually treatable, how come we're still having huge amount of Nigerians, children dying from malaria? You know, what is it that we have not done well concerning management of malaria in Nigeria?
Well, the issue is, talking about the availability, accessibility to some of these our public facilities. It's not evenly spread. In some places, before they can access these public facilities, is a bit far from where they stay. So, and also, some of our the caregivers, sometimes, some of them are not, maybe because of the lack of awareness of what they're supposed to do when their child come down with malaria. That one too is there. So, because if they don't give the proper treatments and give the appropriate drugs to that child, especially prompt treatments in a child like that, they can easily develop a severe malaria, and which is life-threatening. So those are the issues. The issue is that our health facilities might be far from where some people stay. So, and if they don't have access to those facilities, they will go for alternate care. And if the child is not properly cared for, we are likely to have an increase in the number of child that will come down with severe and deaths. So those are the issues. Then prevention too is also, I will always emphasize on prevention. If our caregiver knows how to prevent, it will reduce the incidence of malaria, so there will not be need for treatment and management again. So prevention too is also is a key issue that we need to really enlighten our people, the populace.
Bamiselu, he is the program manager at Ogun State Malaria Elimination. He joined us live from Abeokuta in Ogun State. Many thanks once again. We'll take a quick break. When we return in a moment, we will be joined by Dr. Israel Oladipupo Ogunsheye, a public health advocate, and talk more concerning reduction of malaria here in Nigeria and beyond in a moment when we return. Stay with us.